The case this morning is a posterior cervical fusion. So unlike an anterior cervical fusion where you're going from the front of the neck, here we're going from the back of the neck and basically clean out arthritis, anything that's causing pressure on the nerves. Main advantage of a posterior cervical fusion is that it gives you a larger surface area to decompress. You're able to provide a more aggressive decompression. When we do this, we usually put in some pins or what are called lateral mass screws that basically affix onto the facet joint and provide a solid fusion and do some arthrodesis, which means shaving some bone off and laying bone graft on the side. The downside of posterior cervical fusion, usually patients find it a little more painful because you do have a lot of the paraspinous muscles in the neck that you have to go through. Disconnecting the muscles of the neck too do pose some risks of postoperative kyphosis or hunching over the back and problems with posture as well. My preferred technique, as a result of that, usually is anterior cervical fusion. But in some cases where you do want a more aggressive decompression or where a patient has had multiple prior anterior fusions, or for example, someone has had radiation in the front of the neck, a posterior cervical fusion is still a better option and a safer option because it allows the benefits I described earlier. So this kind of case usually takes me about an hour and a half to 2 hours. I'm doing 4 levels today, usually a couple nights in the hospital for the patient.